So, Ms. Ishi, coming to you, and from the years of experience and dealing with patients who are struggling to have a good diet and to contain various kind of chronic diseases, and diabetes being one of the most common, I'm sure you have really interesting and real life stories to educate us a little bit about this and the bridge between good gut health and controlling diabetes.
Yes, Arjun, the journey of learning for me personally has been really very interesting, and I would say, coming from a nutritional background of nutrition science, I practiced what we learned in our tech through our textbooks. And up until, I would say, 10 years ago, those tools helped us manage blood sugars. The tools helped us manage things like obesity, extra weight, belly fat, and the numbers like cholesterol, etc. But when we started understanding the connection between the gut, the microbiome, inflammation, and chronic inflammatory diseases like diabetes, type 1, type 2, it was a paradigm shift. It was so rewarding. It was it was like those aha moments, that, oh my God, this happened. And then you study more and get into the depths of things, and you put it in clinical practice. And without exaggeration, I began to have a problem in terms of managing the physician and the patient, because the rapidity of change in blood sugar levels, the rapidity in change in general overall well-being, by addressing gut health, by addressing nutrition, by addressing overall, the calories and macronutrients, and the other lifestyle issues, not to miss those. The holistic approach. When we started working on that, I was having a problem with the medication and the managing the insulin levels, because the patient would nosedive. The sugars were just getting into hypoglycemic states. And so, in fact, the case study we will be having will showcase that issue. And therefore, that was a challenge for me. And we have been through struggles and these kind of challenges, but certainly addressing the gut and the root cause of the disease has been an absolutely big game changer for me. And, I would not hesitate to say that early diabetes can also be reversed.
Mrs. Ishi, so I would like to ask you that we are talking so much about the gut microbiome and talking about how to balance this diet in order to control our blood sugar levels. And overall, in a nutshell, what would you say that how do we strengthen our gut? And especially for diabetics, what are the key concepts or the key points or the takeaways that you would advise us?
Thank you, Arjun, for that very important question, because as practitioners of science, we talk scientific jargon, which confuses people and makes our advice redundant, and sometimes, not even have, it's not even followed, because no matter how much I give you, even for me, if I'm to do a two-third, one-third, 70%, 80%, or even if you look at label, I will not decode it and put it into practice. I eat food. So one of the biggest takeaways from today should be that we talk in real-time food. And food is really broken down into food groups. But before I go there, if there is one word, because I don't like to, call a label a diet and limit it, calling it a keto or calling it a gluten-free or calling it a low-cal or a low-fat, all of these get very limited and very skewed by the end of it, very imbalanced. So all the word, if I have to give it a word, it will be an anti-inflammatory diet. And that is where the whole concept of whatever has been spoken fits in, that you have more polyphenols, you control your carbohydrates, you have less insulin, which is also pro-inflammatory. So overall, the inflammatory quotient of all the food that you eat should be very low. And thereby, it means that you avoid foods which trigger inflammation for the gut, And in a simple way, I would just put it, since we are talking gut, microbiome, obviously, what is not good for your gut, what is not good for your microbiome is not good for you. And they like food which is friendly, free of toxins and free of chemicals. And they love fiber. That's their food. Polyphenols is their food. Good fats are their food. Even, we abandoned, just for example, abandoned butter and ghee from the Indian homes. It was a sad development which happened somewhere in the 80s and 90s, and everyone was using highly polyunsaturated pro-inflammatory fats in place of food for the gut cells. Butyric acid is food for the gut lining, for the mucosal membrane. And butyric acid, the biggest source in our food is butter and ghee. So just to give you a simple, example of how we have to use the right kind of anti-inflammatory foods to build up our gut microbiome, to build up the gut strong, the mucosal membrane to be strong, and prevent or control the leaky gut. I'm still not answering your question in full because I've got a little qualification to do regarding the wheat issue. And here, I would say that in my practice today, one of the biggest triggers for what we call a leaky gut and a disturbed microbiome leading to inflammation has been found to be wheat, because of its connection with, I mean, these are very new concepts. Zonulin. The zonulin, I mean, there are other aspects as well, but this is one of the most important. And zonulin is secreted in the gut by wheat protein, which is gliadin. And that is highly, highly pro-inflammatory. So who is a candidate for wheat reduction or wheat elimination needs to be established by the fact that if you have an established diabetic condition, that means you have inflammation. That's the origin, and you have a disturbed gut. So I would use wheat as one of the most pro-inflammatory foods, and very easy to substitute in the grain scenario which we have in the environment, in the ecosystem of, at least in India and across the world. I think it's not that difficult. But we have a variety of grains. We have millets and we have pseudo cereals, etc., which can be substituted, which in clinical practice actually work. And we have the advantage of low glycemic pulses, which if you mix with the grains, you lower the glycemic load and the glycemic index, and we get fabulous results. So that is a question which really needs, customized advice, of course, and an important, I would say, takeaway for the audience. And when we come to diet, it's not about just what you eat. It's about how much you eat. It's about when you eat and how you eat. And all of these today have a scientific basis. I mean, how much to eat is, we all need our, this has been discussed. The best way to represent how much food you need is through the plate. Just have half your plate full of vegetables and divide the others with protein and grains. And since I haven't specified the food groups, simply put, we have vegetables and fruits as one food group, and then we have the proteins, then we have the fats, and then we have the meats and the proteins and the dairy. Dairy also has been found to be a trigger food for some people who have disturbed insulin levels. And that science is also clearly established and backed up by our clinical experience. For instance, if Anuradha ate curd, or she ate an ice cream, not forget the ice cream because that has sugar. If she ate paneer or something, 2 days later, her blood sugars were elevated and remained elevated for 2-3 days without any other factor interfering. So we know this for a fact, that there is something which is triggering inflammation with milk protein. So both these are important tools which can be used by a clinician to manage the food, but that's oversimplification of the diet. So
Thank you.
yeah. So
Yeah,
yeah, I think that's the timing is important, portions are important, and how you eat also, and how you live the lifestyle. It has to be an anti-inflammatory lifestyle. Over to you, Tom.
Dr. Tom, I want to ask you one question. With your statement, I think one of the most important pathogenetic mechanism of development of diabetes, which we also call the pro-inflammatory state, is the leaking gut and the LPS and the gluten. If this would have been the important factor in triggering the inflammation and causing the type 2 diabetes, wouldn't we eradicate the diabetes from the whole world by giving the proper dietary advice?
That is a wonderful question. I don't think we would eradicate, but we would greatly reduce. If I ask Ms. Ishi, ballpark, what percentage of your patients, when you put them on a gluten-free diet, their blood sugar stabilizes? What percent?
100%.
100%. So what that means,
when they follow the diet, you can, it's so like I said earlier, the word oversimplification. So it doesn't mean that I start giving you mounds of rice or starchy food or unhealthy food. So within carbohydrate exchanged and controlled, and I have done that within, because I understand portions. So there was one patient who came very, very lean, had no other risk factors, but her fasting sugars were always over 100, and she was baffled. I said, instead of that one roti that you have the equal amount of carbohydrate through rice, and that is about half a cup, one small chapat. And she had been battling this for 5-6 years, and she came back to me in 10 days with a fasting sugar of below 100. It was 95, and she came and hugged me and she said, I've never seen that reading. Just isocaloric, same amount of carbohydrate, but the nature of carbohydrate was different. Absolutely. Yes. And no other, we didn't change anything. So I have done this in clinical practice on several patients. But today when I treat the patient, this is for science, for people who have a scientific mind to control the variables. But when I treat a patient, we have so many other, we look at the nutrition, we look at micronutrients, the proteins and the other aspects. So it's, I will not make that comment as, everybody improves. But if I have to just say substitution, from wheat to rice, and mind you, wheat to rice means I'm having a lower fiber diet. If I'm not changing the quality of rice, if it's white rice, it's the same. And even then, this is what we find. So it's
and this is very, very important.